Welcome back to CBS 2 News at 9 a.m. on this first day of December. Now, earlier in the show, we told you it is World AIDS Day, a day to raise awareness about those living with HIV/AIDS and to highlight how far treatment options have come in just the past few decades. Joining us now over Zoom is Dr. Oni Blackstock, a primary care and HIV physician and the executive director of Health Justice. Dr. Blackstock served as a former assistant commissioner for the New York City Department of Health and Mental Hygiene and led the city's response to ending the HIV epidemic. Good morning, Doctor. Thanks so much for being with us.
Good morning, Cindy. Thanks so much for having me.
Doctor, what are the latest treatments for those who test positive?
We've really come a long way. Now there is once-a-day pill that people can take that are highly effective in treating HIV, and that's compared to sometimes people would have to take up to 16 pills multiple times a day when medication was first introduced. We also have injectable HIV treatment as well that allows folks who might be maybe struggling to take a pill daily to have another option, and so they can take an injection every month or every 2 months. So the more options we have for folks, the more possibilities we have and the more support we have for folks to take their medications and to achieve what we say is viral suppression, which allows people to really sort of live longer, have improved health, and also they have effectively no risk of passing HIV to other people, to their sex partners.
Doctor, let's talk about PrEP, what it is and why it's so important.
Yes, so PrEP is a once-a-day pill. It's safe and effective, and it's taken by people who are HIV negative, so someone who does not have HIV infection, to prevent acquiring or from getting the HIV infection. It's a daily pill. There's also now an injectable form that folks can take as well that does not require sort of daily dosing. And so it's a really wonderful way that folks can use to stay safe. We also have post-exposure prophylaxis, a pill that can be taken after someone has had an exposure, and we also have condoms and HIV testing so that people know their status.
Doctor, how important is testing and what do you recommend people do?
Yeah, testing is incredibly important. It's recommended by the CDC that everyone between the ages of 13 and 64 have at least one HIV test in their lifetime. Knowing your status allows you to stay safe and keep others safe. If you're HIV negative, you can then use condoms, PrEP, as we mentioned, post-exposure prophylaxis. And if you test positive, you can initiate care and start really effective treatment that has really allowed people, many people living with HIV, to have very long and healthy lives.
How do shame and stigma impact people living with and affected by HIV and AIDS, and what can be done to help them?
Yeah, so that is one of the things I think we have these really effective medications for prevention and treatment, and it'd be wonderful if we had a medication to address stigma. Stigma can be internalized by people living with HIV. They can sort of take in sort of these negative beliefs about themselves, and that can affect whether they want to take their medication, whether they want to go to their appointments. And so it can have really negative health effects on the person living with HIV. And also people who may be HIV negative, they may feel that only certain people get HIV and so may not see HIV testing as something that's important to do or to use other forms of HIV prevention. So stigma is sort of our last battle in the HIV epidemic, as well as ensuring that everyone has access to the effective HIV prevention and treatment tools that are available.
Dr. Blackstock, thanks so much for joining us this morning and for all the important work you do.
Thank you so much for having me.